the methodology for doing a review, as I had told you in the previous class also, that it is same for all type of review. In systematic reviews, in meta-analysis, there are certain additional steps are there. Otherwise, all the steps are same. Okay, so first step is identifying the research question. Okay, now, so I had already told you that what a research question is, and a research question is defining a research question will help you the strategy which you can use for doing your or searching your literature, and also you can have your objective, like what is your objective for doing this review. So for that purpose, it is important that you have a research question. So first you have to identify a research question. So here the research question is, the research question that guided this scoping review was, what is the relationship among cellulogenesis, sense of coherence, and cardiovascular health in adults? So this is the research question here. So in similarly, like from the topic itself, like this is the topic. So from the topic itself, you can identify that what is a research question. Now here, the research question, the topic indicates that this review is related to a relationship, to set up a relationship that how cellulogenesis is related to cardiovascular health in adults. So similarly, it is defined here, the research question. So same way, when you're writing any review, any kind of review, so first you have to identify the research question, that what research question is, and that you have to mention in your article. Now next step is, now, when you have identified a research question, the next step is identifying the relevant studies. So now you have to identify the relevant studies. What are the relevant studies? And according to that only you will be doing your literature searching. So for that, first you have to identify sources of information and literature. So first you have to write about the timeline. First of all, the articles were identified by searching and analyzing all the literature published in English and Spanish between 2000 and 2016. Now here you can see, now this defining this timeline is very important. Okay, now you have to mention here the timeline. Now timeline is always, you have to take a time period of at least 10 to 15 years. It should not be like this, that you are writing it, that you have taken the studies of 2 years or 3 years. No, until and unless it is mentioned. But you have to, if it is not mentioned, then you have to at least select the timeline of, there should be a time period of at least 10 to 15 years. Okay, so then those years also you have to write. So this time, which is written here, 2000 to 2016, it defines that the author has searched the articles which are published on this topic, in between the years 2000 and 2016. So similarly, you also have to take the timeline of, or a window of at least 10 to 15 years for searching your literatures. Okay, then you have to mention the name of all the databases which you have followed for searching the literatures. Like here it is mentioned, PubMed or Medline, Academic Search Complete, Selico, Socialo, Chanel, and Villi Online Library. So generally, these are the only databases which are most frequently used by the authors, by the medical writers. So you can also use these databases in case if apart. So whatever databases you have, whichever databases you have considered for searching your literature, so you can write the name of that database. In case if you are using any software, like there are various reference management softwares, if you are using a Manley or EndNote, so there are various databases also, like these softwares are also available, which will help you in doing your literature search. So when we finish all the review, I'll share an article with you, so that in that article you will get that how to search the, like what are the different softwares or applications which are available to you, which you can use for searching the literatures. Like for example, one software is Manley, which is very frequently used for searching the literatures. And the advantage of using Manley is that it is a free software. You do not have to take the subscription. And the most frequently used software which is used for the purpose of writing any kind of for doing the literature searching and for reference management, that is EndNote. Okay, but EndNote is a paid software. You have to take the subscription to use that software. It comes with certain limitations as well. So once you are in this profession and you have a regular flow of work, then you can get the subscription. But as a beginner, you can use Mendeley. Okay, if you're not using any database, you are doing the literature searching manually. So in that case, you have to mention this, like whatever databases you are searching. So you have to mention the name of the databases which you have followed for searching your literature. Then after that, you have to write about the keywords, like what are the keywords which you have used. So keywords means keywords you can define from this only, from the topic itself. Now there is one more scheme or framework which is used for defining the keywords, that is the PICO framework. So have you all heard about it? About PICO? P-I-C-O. And it has recently introduced S also. PICO-S. Have you ever heard about this? PICO-S. So now this PICO-S framework, it is used for defining the keywords. PICO-S framework is helpful for you also, or it will be helpful for you to framing your search strategy for searching the literatures, for framing your inclusion and exclusion criteria, for screening the literature. And these are, and this is where P stands for population. Okay, if you want to write it down, you can write it down as well. P stands for population. I stands for intervention. C stands for comparator. O stands for outcome. And S stands for study design. Okay, so now here P means population, means the study which is done on, the study is done on what population. Suppose, for example, the title of this study is Salutogenesis and Cardiovascular Health in Adults. So here the population is defined as adults. Here you have to see, or here you have to see the effect of salutogenesis or how it is related to cardiovascular health in adults. C is comparator, okay, and O is outcome, and S is study design. So I will tell you what is the meaning of each term. Then so P means population, means on what population the study is based. Sometimes it is based the population of North America. Then if sometimes it is based on the pediatric population, on the elderly patients. So those that like population of North America, elderly patients, okay, pediatric population. So that defines your population, the specific population on which the study is based. Then next I stands for intervention. Okay, intervention means the treatment, the drug, the therapy on which the study is done. Like for example, here the salutogenesis. Salutogenesis we can consider as an intervention because we are studying the effect of salutogenesis, or how salutogenesis is related to cardiovascular health. So here in this you can consider salutogenesis as intervention, but generally intervention is a drug. Like if you're seeing if you are seeing the effect of any drug, like for example statin therapy, a particular drug, for example amlodipine, or a particular treatment, for example if it is mentioned dialysis therapy or dialysis treatment. So any treatment, if in any study you are doing it to see the effect of any treatment, any process, or any therapy or any drug, so that is known as intervention. So the name of the drug or the test drug or the therapy or the treatment, that you can consider as an intervention. Then C stands for comparator. Comparator means suppose it is the study where we are comparing the effect of the two drugs. Suppose it is mentioned that randomized controlled trials. So in randomized controlled trials, generally the control is used as a comparator, where a control can be a placebo or a dummy medication, or a control can be any reference drug. Okay, any reference drug which is already in the market. So we are comparing the effect of that reference drug with the test drug. So that is known as a comparator. Okay. So what happens in randomized control trial? The participants, they are divided into two groups randomly. Okay. And one group will receive the test substance and the other group will receive the control. Now that depends upon the study design and what type of study it is and what is the comparator which is being used, whether the comparator can be a placebo. Placebo, you all understand what is a placebo? Any drug, like not it can be a simple solution also, it can be anything which do not have any therapeutic action. Okay, that is known as a placebo, or a dummy medication, or any, or sometimes there are other alternative medicines are also used as a control. So they are known, that is known as a comparator, the which is used for anything which is used for comparison. Then O stands for outcome. Outcome means the about what disease we are doing a study. So here, suppose if we take example of this study of the title, it is mentioned cardiovascular health. So here the outcome, we are seeing the effect of salutogenesis, or how salutogenesis is related to cardiovascular health. So here cardiovascular health can be considered as an outcome. Similarly, if the name of any disease, like if it is an article, it is mentioned to see the effect of a randomized control trial designed to see the effect of statin therapy in elderly patients. Okay, in elderly patients, statin therapy on a high cholesterol level in elderly patients. Okay, so here the outcome which is being studied is high cholesterol levels. Okay, that is or hyperlipidemia. Okay, then so similarly, if any title, any disease, if it is mentioned, so that is known as the outcome, like for what outcome you're doing the study. Then S stands for study design. So study design means like what kind of studies we are considering here. Like here it is not mentioned, but generally if it is mentioned randomized control trials, non-randomized trials, cohort studies. So all these types are, all these studies are considered. So this, like randomized control trial, is a particular study design which is followed for doing a clinical research study. Non-randomized trial is also a type of study design which is followed. Blinding study, which it is also a type of study design. So there are various type of studies that we will discuss when we will discuss about clinical research in detail. So in that you will be then in that you will come to know that what are the different study designs which are followed for doing a study. Okay, so that is known as a study design. That's what particular kind of study you have to search, on which your review will be based. Okay, so this PICO-S framework, that is population, intervention, comparator, outcome, and study design, that will be giving. So with this you will get an idea that what are the keywords which you have to use. Like if you know that on that what population you have to consider, what is the intervention which you have to study, what is the comparator, if there is any comparator, then the study should be based on what outcome, and what is the study design you have to follow. Then it will become easier for you to come up with the keywords, and only using those keywords only you can do the searching. And now you can make the different combinations of those keywords by using the Boolean operators. Boolean operators, like you can use it like this: sense of coherence and salutogenesis, like this you can make combination like this, or sense of coherence or salutogenesis, or like the two words which can be, if there is any synonym of salutogenesis, then you can use like using the word or, and then you can use adults or like this. So by making certain combinations of the keywords, you can use, or you can do your searching. Okay, so this is how you can search your information, and all these things you have to mention in your article. Like first thing which you have to mention when you are mentioning about like how you have identified the studies, first thing which you have to mention, that is the timeline. Okay, so like what is the timeline which you have to follow for doing the study, like for searching the studies, like it should be there should be a window of at least 10 to 15 years. Okay, the next thing which you have to mention here, that what are the databases which you are following. In case if you are following any reference management system, then you have to write the name of the reference management system that you have searched the studies by using this reference management system, or if you're, and then you can write the name of the databases that from where you have got the studies. In case if you're not following any database, if you're not following any database or any reference management system, so in that case, if you're doing a literature search manually, then no need to mention that. You can directly mention the name of the databases which you have followed for searching the literatures, like as it is written here. Second thing. Then third thing which you have to mention, that you have to mention the name, the keywords, like whatever keywords you have followed for writing your literature, for searching your literature, those all keywords you have to mention. Okay. So now next is so on the basis of the PICO-S framework, which I have told you, and on the basis of your topic, whatever your topic is, whatever your research question is, you have to define your inclusion criteria. Okay, like here the author has written, the studies were reviewed based on the following inclusion criteria, indexed in quality sources of knowledge. Quality sources of knowledge means the literatures which have the maximum information or the most significant information which is related to the topic. Now, as this article is published in 2 languages, that is in Spanish or English, so here the authors has considered the articles either they should be published in Spanish or English, but in case if you're writing it in English only, then you have to mention that the article should be published in English. Then full text available. Full text available means now you must have gone searched, when you search for the literatures, there are various articles which are not available. Only the abstract and title is available. The full text of that article is not available. Okay, either it is paid, or sometimes the author does not give the right to anyone. Like you have to, in that case, you have to write a mail to author. You have to tell your purpose, that what purpose you are you want this article. Then if they agree, then they will give you the access. They'll share the link with you where you can access those articles. Otherwise, there are certain database for which you have to take the subscription, and then only those articles are paid and they will be available to you. Okay, so, and generally these articles are very expensive. Their value is in, if they are published by the foreign authors, then they charge for in dollars and euros, which is in Indian rupees very costly. Okay, so you have to take the articles only for which you have the full text, means you have all the information of those articles like we are seeing here. Otherwise, only from the abstract and only from the title, you will not be able to understand that what actually defined in the study. So only the author here is considering the article of which the full text is available. Now here, the population, we know that population, the study is done on adult population suffering from any cardiovascular disease. So population of patients with chronic or coronary disease means the author is considering here the studies or the articles, the literature, where the study is done on only the patients who are suffering from chronic or acute coronary disease. Okay, then the age of the population should be adults older than 18 years of old. 18 years old. Okay, that explicitly adopted cellulogenesis and their theoretical framework, means the studies which are related to cellulogenesis, that is only considered here. The authors will only select those studies. Then studies that only provide an abstract or whose population were adolescent or children were excluded. Okay, so now like this only, in the same way, by defining your research question and understanding the PICO-S framework, like what is the population, what is the intervention which is studied, what is the outcome comparator, and what is the study design which is being followed. So that according to that, you have to list out at least 8 to 9, like 6 to 7 points. Okay, and sticking to those 6 to 7 points, which is your inclusion criteria, you have to take, or you have to screen the studies according to that only. Okay, and then there will be, if there is something specific which you do not want in your studies, like here the author has explained that any study in which the population is adolescent or children, because this study is based on the adult population only. So here this is the exclusion criteria. So if any study which is fulfilling any of these criteria, then that will be, so like the studies, they have to fulfill these criteria, like these criteria that will be considered or that will be selected, and any of the study which is having this criteria, that will be rejected or that will be excluded. So according to this inclusion criteria only, you have to select the studies. Okay, understood what is inclusion criteria and what is its significance and how you can frame it out now. So this also you have to mention in your study, like when you are writing an article. So this also you have to mention. Now the next step come. Now you have your search strategy, like what strategy you will be using, what is the timeline you'll be following, what are the database you will be following, what are the keywords which you have followed, and then you have also defined your inclusion and exclusion criteria for selecting the studies. Now you have to tell your what is your selection process, how you have selected the studies. So now for defining this selection process, there is a diagram known as, or a flow chart, which is known as Prisma flow chart. Now Prisma are the reporting guidelines which are used for writing systematic reviews or meta-analysis, that we will discuss in module number 7 in detail. What are the Prisma guidelines? Just for now, you can understand that Prisma is a flow, like Prisma is a reporting guideline which will provide you with a checklist which contains at least 28 to 30 items, I guess. And then it gives you a flow chart also. Now with the help of this flow chart, you can define your literature searching process, not the literature searching process, but the study selection process, like how you have selected the study, how many studies you have identified, then how many duplicate records you have removed or excluded, then what are the studies you have excluded at every stage, and why you have excluded those studies. You have to tell the reasons also. The idea behind giving this flowchart is, first, if the same information if you have written in a textual form, then it will be very difficult to understand for the readers. The readers will get confused. Now from this flowchart, it becomes easier for the readers to understand that how you have selected the studies, and also it indicates your efforts, like what are the efforts which you have made for writing this review. You have actually conducted this review, because after that only you will be when you have actually conducted this review, then only a person will be able to give this kind of elaborated information. If you have not actually performed the review, if you have just taken the information and copied and pasted from anywhere, then this type of elaborated information will not come. So for this purpose, to increase the credibility of your document, you have to give this Prisma flowchart in all the studies, on all kind of reviews. Whether generally in literature review, you will not find it, because literature review is a very simple kind of review which is done. But when you're writing a scoping review, critical review, systematic review, meta-analysis, umbrella review, so in all these kind of review, you have to give this Prisma flowchart. It is mandatory. Okay, now this flowchart, it is divided into 3 stages, that is identification, screening, eligibility, and inclusion or included. First is the identification. So here in this box, you have to give the number of articles which you have identified after searching various databases. If you want, you can write the name of the databases as well. Otherwise, you can just write the number of studies which you have identified. So here the author had identified 299 studies. Okay, and then if not from the database, if you have got any additional information from any of the clinical studies which are identified from the clinical trial website, that is a registered website of government, then from any web pages, so that you can make an additional box here like this. Like you can make an additional box here. Okay, and suppose, for example, 50 studies or 50 from 50 articles, you have identified the information from various, which is not a published article, like not in the form of a research paper. It is like the information which you have found on different websites in the form of web pages and all, so that you can include. So this number, that is which is approx to 300. Okay, then you can add on this number, that is 300 plus 50. Then number of articles which you have from which you have screened, so that will become 350. In case if you have not taken any information from any of the web pages or additional sources, you have considered only the research articles. So in that case, there is no need to give this additional box. You can just, in one box, you can explain that number of studies which you have identified from various databases. Okay. Then number of duplicate records or mentions that were eliminated. Now, first you have to exclude the duplicate records. Now I will tell you that what are the duplicate records. Duplicate records, now duplicate records can be generated in two ways. First way is like the reviews, any review article, when it is written, there are number of authors, like there are 2 to 3 authors who are doing the who are involved in doing a review or writing a review. Okay, so first what happens, so in that case what happens, you have a search strategy, you have the keywords, you have the inclusion criteria, and all those three authors, if they are searching the literatures, because literature searching is a very complex process. So all the authors generally, at least 2 to 3 authors, they are involved in searching the literatures and using the same keywords, using the same strategy, same inclusion and exclusion criteria. So there are chances that there are some studies which are common. Like I have also identified that same study, you have also identified the same study, and some other author also identified the same study. So then when you combine all the studies, then there are many studies which are common. So you will remove those studies. That is one way of removing the duplicate records. Now, second way is that sometimes some information or some articles, maybe the title of the articles are different, but the information which is shared in that article, in those articles, that is quite similar. Okay, it does not have any difference, a significant difference. It has the similar kind of information or similar kind of data which is shared, not the data, but the outcome is sometimes similar. There is nothing new or different from from in the two studies, difference in the two studies. So in that case, you exclude out the one study and you will keep the other. So this is how you can remove the duplicate records. Okay, so total number of duplicate records or mentions that were eliminated. So the author has eliminated 89 studies. Like 89 duplicate records were there, and after eliminating those records, there are only the records which are left for screening, that is 210. So now when you will perform the screening, so first you will perform the screening of the literature on the basis of its title and abstract. First you will go through the title and abstract of all the literatures. Do not first, or the first step, in the first step, do not go through the full article, only go through the article, text of the article, sorry, the title of the article and the abstract of the article. From by going through the title of the article and also the abstract of the article, you will understand that so major information you'll get, and you will understand that this article is not relevant to you, or this is whether this article is relevant to you or not. Okay, so then after, and then the total number of records which or citations which are screened on the basis of full on the basis of article like the title and abstract, 210, out of which 125 articles were excluded. And then here you can write the reason also, that why these articles are excluded. Okay, then after that, for eligibility, like what articles are eligible or which articles are eligible, which are not eligible. So in that you have to write the total number of now the articles which are left behind after excluding the articles on the basis of their text and like on the basis of the title and abstract. Now the articles which are left behind, here 85 articles are left. Then those articles you will access for full text. You will go through the full text of that article. So total number of full text article assessed to determine eligibility, that is 85. Okay. Now here in this box, which you will make here parallel, so you have to write that total number of full text articles which were excluded, that is 56, and then you have to mention the reason also, that why you have excluded these articles, like salutogenesis framework not explicit, not related to cardiovascular health, inadequate population. So this you can mention. Then after that, in the last box, in the inclusion, you have to mention the total number of studies which were included in the qualitative synthesis of exploratory review, or simply you can write for doing this review, that is 29. So amongst now the articles or the literatures which the author have searched here, that is 300, and from 300 articles, only 29 articles they were taking into consideration. Okay. The next is assessing methodological quality. Now, this step is not actually, this step is optional. Okay, that depends upon like what type of review you are writing. So like where you can access the methodological quality of the studies, like what is the method which is used for doing any kind of study, whether that methodology is significant or not. You verify that methodology, whether the methodology which is explained in that study, like using that approach the study is used, whether it is practically possible or not. So that is optional. If you want to do it, that is an additional step you can do. Otherwise, you can just do the quality assessment like in the previous step only. When you have selected the studies, you will be selecting the studies when you are doing the full text review of those studies. In that only you can access or you can do the quality assessment of the study, that whether this study findings are significant or not. Then only on the basis of that you can include it in your article. So I'm just skipping this step. The next step is recording of data. Recording the data means like extracting out the information which is significant to you. Okay, which is significant to you, which information you want to include in your article, like include it in your article. So the fourth step in the review process was to carry out a structured and logical summary of the data, identify themes, and describe the results according to the objective and research question created to carry out the scoping review. To this end, the data extraction table was created, which included the following information categories, that is authors, year of publication, country, study objective, population, sample, methodology, and main findings. So now I will tell you that how you can do this data searching or data extraction process. Now this process, it is not mandatory that you have to mention in your article. You can just mention that the recording of the data was done using this a particular method. That's it. You do not have to write the extracted information in any article. Okay, so I will tell you that how you can do it. So you can write it on, you can make a Word file, or you can write it in your notebook, whichever method is convenient to you. So first, like the first study, write the name of the author, like write the name of the title, like first write the title of the study, write the name of the author. Okay, then you can, then in that title, in that study, what is the objective of that particular study, which is already mentioned in the study. So that objective you can write. Okay, you can write it in your own words, or as it is, if you want to copy, you can do that. Then on which population the study was done, that you write. Then what is the sample size which is used in that study, like how many patients, or on how many patients, or what is the population, like it is, the study is done on 100 patients or 100 individuals, or it is done on 500 individuals. So depending upon that, what is the study, what is the number of patients, or what is the sample of the population, that is known as the sample size. So that you have to mention. Then what is the methodology which is mentioned in the study, that you can write. And then what are the main findings that you can get from the result section. So this is how you have extracted the data from each of the study. Okay, now for the second, now this is for the first study, name it as number 1. Now same process you have to repeat for the second study, for third study. Now the idea of writing it in this way, that is, like suppose for example, like there are various articles. Of course, you will not take the printout of all the articles. Okay, you will read it in your system only. Okay, so now you cannot, if you want to mark any information, so you can mark. Otherwise, you can record the data like this, so that again and again you do not have to go through with the same studies. Once you have taken down all the information from first article, your work is complete. Now you switch on to the second article, then to third, then to fourth, and so on. You do not have to go through the same articles again and again. because you cannot store everything in your memory. You have to write it somewhere so that you know that in first article, these are the main points which I have found out. These are the findings. In the second article, these are the findings. In the third article, these are the findings. Okay. So you have to just go through this summarized information when you are actually drafting this review. You do not have to go through the articles again and again when you're drafting the review, which is again a waste of time. Okay, so this is how, by doing this, you can record the data. Okay, is it clear? Then the fifth step is like summarizing and reporting the results. So you have to summarize the information and then you have to report the results. Okay, so this step also, like this fifth step also, there is no need to mention like how you are summarizing the result, because the same thing you will be in the result section. When you are writing in the result section, the first thing which you have to mention, that is characteristics of all the studies. Like what are your findings from the studies? What are the main findings from the studies? So like this you can explain. Okay, now, so this is the methodology of doing a review. So these are the 4 to 5 steps which you have to follow for doing any kind of review, not only for scoping review.